I'm Dr. Patricia Pellica from the Department of Cardiovascular Medicine. I'm the senior author on this study, and with me is Dr. Ruth Bates from the Division of Hospital Internal Medicine, the lead author on the study. Our paper, Impact of Stress Testing for Coronary Artery Disease Screening in Asymptomatic Patients with Diabetes Mellitus, a community-based study in Olmsted County, Minnesota, will be published in an upcoming issue of Mayo Clinic Proceedings. We were interested in this subject because diabetes mellitus is a common disorder affecting more than 9% of the United States population. Moreover, cardiovascular disease is the leading cause of morbidity and mortality in patients with diabetes mellitus. Patients with diabetes mellitus often lack the warning signs and symptoms of coronary artery disease, and therefore stress testing has been proposed as a means of identifying those at highest risk. But this has been controversial, and the latest guidelines do not actually recommend doing stress testing in patients with diabetes, although previous guidelines have recommended that it be performed. There is very little evidence, however, to guide us in the optimal strategy, and therefore we selected this community-based approach to study the population.
In this observational study, we looked at the population of Olmsted County using the Rochester Epidemiology Project and took those patients that were newly diagnosed with diabetes and followed them through time. In Figure 3, you can see our analysis of the Kaplan-Meier survival curves of those patients that survived event-free up to the 2-year mark post-diabetes diagnosis. And at that point, they were split into 2 cohorts. Those that had received a screening stress test up to that point were then defined as the screened cohort. Those that were still asymptomatic 2 years after diagnosis of diabetes but had not received a screening stress test, they were the unscreened cohort. And you can see in Figure 3, up to 15 years of follow-up time, there is a survival difference between those 2 curves, despite the fact that the screened cohort actually had higher baseline Framingham risk factors.
So in summary, we found that stress testing as a screening test for asymptomatic patients with diabetes mellitus was associated with improved outcomes. However, more information is needed to determine which patients should receive the screening test and how the screening test led to improved outcomes. The unique population-based study using the Rochester Epidemiology Project was helpful in conducting this study, and the unique methodology employed here could be used to study other populations and answer other questions where the management strategy is uncertain and enrollment in a prospective study could be very difficult. Thank you. We hope you enjoy the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.